It's now required in the sense that if you have a cisplatin ineligible patient in that frontline setting, then you should think about PD-L1 testing if you're thinking about using immunotherapy. Unless that patient just can't receive chemotherapy, then you're going to want to think about PD-L1 testing if you're going to use an immunotherapy. It's required if you're going to use an immunotherapy if that patient is chemotherapy eligible. So the way I think about it is, I look at the patient. If I think that they could receive gemcitabine carboplatin therapy, I'm generally going to choose that. If I'm concerned about my patient's chemotherapy fitness, then the label would suggest I could just give that patient immunotherapy. But I find myself wanting to, test the PD-L1 status in those patients that are sort of on the border, right? I might be able to give them gem carbo, or they might do better with immunotherapy. Those are the patients we really need to know the PD-L1 status now, because if they're PD-L1 positive, I'll recommend toward that patient pushing toward the immunotherapy. If they're PD-L1 negative, then I'm going to try to improve that patient's performance status to be able to get gem carbo.